into Women OBGYN care, and I'm here today talking about vaginitis. Vaginitis are one of the most common symptoms that women complain about when they come to the OBGYN office. As a matter of fact, it's one of the most common reasons women visit their OBGYN. So we're going to talk a lot about the causes of vaginitis, what is vaginitis, and how you can decide whether or not you need to go to the OBGYN versus trying to manage it yourself. Now, vaginitis basically describes a cluster of symptoms that affect women's vagina, which includes itching, discharge, malodorous discharge, discomfort, and burning. Now, there are multiple etiologies and causes or etiologies for vaginitis. Some including bacteria, some including yeast, some including atrophy because of lack of estrogen, and some just with unknown etiology, idiopathic. The most common cause of vaginitis in America is bacteria vaginosis. This causes about 20 to 50% of people with vaginitis. Bacterial vaginosis is basically when there's that overgrowth of abnormal bacteria in the vaginal canal, usually allowing for abnormal discharge. Some people will describe the discharge as being white, cloudy, frothy, and definitely having an odor. The most common odor that people describe when they have bacterial vaginosis is being fishy or rancid. Bacterial vaginosis comes from basically bacteria that belongs on the perineum or close to the GI tract, like E. coli, etc., getting into the vaginal canal. The vaginal canal, though not sterile, usually has a different type of bacteria. Bacteria that usually is housed in the bacterial canal includes like lactobacilli. And people who consume a lot of supplements that includes probiotics and so forth might note that they will have a lot of lactobacilli in the vagina. That lactobacilli is able to eat up things that are abnormal, like the E. coli if it's in small amounts, or yeast. Which brings me to the other most common form of vaginitis, which is yeast vaginitis or candida. And overgrowth of that is the second most common cause of vaginitis, running very close behind bacterial vaginosis at about 18 to 25%. Yeast vaginitis is very common in women because of just the environment of the vagina. Yeast loves warm, dark, sweet, and environment that has a lot of hormones like estrogen. So in situations where you have that kind of environment, then yeast flourishes in that situation. Women having yeast, usually that kind of vaginitis is very symptomatic. You'll notice that they start complaining of itching, burning, painful intercourse, and so forth and so on. When that happens, then the yeast needs to be treated, because it's very common that you'll have yeast in your vagina, but when it overgrows is when there becomes a problem. Other form of vaginitis is atrophic vaginitis, and we'll see that in women that are older, who are postmenopausal, and who may not be having a lot of estrogen anymore because, quite frankly, their ovaries no longer produce the estrogen. So what happens is that the vagina is no longer reacting or to the estrogen that's needed to cause it to have a fluffier texture. The epithelium or the lining of the vagina is now thinned and dry, so it has small cracks, and any kind of trauma to that vagina, including like sexual activity or so forth, will allow for that vaginal epithelium to tear, causing burning and itching. Even the vulva on the outside tend to also have a dryness and discomfort. So one of the most common symptoms that postmenopausal women have, other than the hot flashes or sleep disturbance that is often side effects to lack of estrogen, is also vaginitis, atrophic vaginitis. Then of course there's many other types of vaginitis that are rare, and sometimes definitely when we can find, when patients can't understand what's going on, it is very important to come to the OBGYN just to have a take a look at, just to make sure you rule out very dangerous etiologies such as vulvar cancer, vaginal cancer, or even stuff like lichen sclerosis, such lesions that cause significant itching and then can be easily treated. Or caught before it gets to a severe nature. Another important aspect of vaginitis that we need to discuss is what are the other things that could cause vaginitis other than the most common causes that we talked about, which is bacterial vaginosis, yeast infection, atrophic vaginitis, and etc. One of the other causes that we can be very concerned about is STDs, which are sexually transmitted diseases, and those could include trichomonas, chlamydia, gonorrhea, herpes, etc. Now, if we're having vaginitis symptoms, like I discussed earlier, and you're not getting cure from over the counter, which is not usually very helpful anyways, then we need to make sure that you get tested for an STD. It is very important. It's one of the most common forms of infection in America, and these infections can lead to not only significant morbidity, and mortality, of course, in certain cases, but it can lead to situations such as infertility. Chlamydia, which is one of the most common forms of STDs in America, and commonly affects our younger, late teenage to young 20-year-olds, can lead to blocked fallopian tubes, which allows for infertility. So it is very important to come in and see the OBGYN to get tested. If you're noting that you've been seeing this abnormal discharge, burning, lower abdominal pain, itching, irritation, and you're not getting any kind of resolution by taking over-the-counter treatments. So STDs really need to be ruled out in the case where you're having any of these symptoms. Especially if you have not seen an OBGYN or a GYN in a few months. Definitely don't stay home trying to use Vagisil or any of those over-the-counter medication thinking that it's going to go away. Come on in and get tested. Now, we have a lot of misconceptions of what is a healthy way to care for the vagina, or a healthy way to treat discharge. One of the most common symptoms, especially one of the most common things that are done, especially in certain communities, are more in some communities than the other, is like wearing of panty liners constantly. Always having on a panty liner. I often tell my patients it's not a good idea. It's known, and among GYNs we try to educate patients that panty liners, unlike panties, allow for, I would say, non-sterile or a more infectious type of environment. Because what happens is that panty liner houses that discharge. It seems dry, but it's moist. Unlike underwear, that if a cotton underwear, for example, that dries. So to me, what I explain to my patients is, if you are having so much discharge, it's best to carry another underwear in your bag than to be sitting on a panty liner for the whole day, because you don't want your underwears to be stained. Because the underwear, unlike the panty liner, dries. And unlike the panty liner, the underwear does not house as much of the bacteria that you're sitting in for the entire day. The other thing is douching. And there are patients that are still, despite the fact that we're in the 2000 teens, we're still having patients out there douching, and the practice allows for significant worsening of infection. If you're having a situation where you're having a discharge and you're having an odor and douching gets rid of it, all it does is it takes it away temporarily, worsens the situation, and by the next month you're again having the same symptom, because that bacteria just comes back, and it comes back with a vengeance. So it's actually a very bad idea to douche. The vagina is not a place that should be introduced soap or vinegar or anything that you think is a cleaning agent. What it does is that it gets rid of the good bacteria and allows for the bad bacteria, which tends to be more aggressive, to flourish for the next time around. Other practices would also include, people putting soap on their finger and putting it inside their vagina to wash it out. The vagina doesn't need that. If you have a normal vagina, you have nothing going on, or even if it's infected, the soap is not going to wash it out. The vagina needs, you wash on the outside of your anatomy, which is your vulva, your labia. You don't wash inside the vagina. The vagina doesn't need soap in it. Or as a matter of fact, it's harmful to put soap inside your vagina. Again, thank you for joining me today as we talk about your vaginal health. And if you have any further questions or concerns, you're welcome to contact me at Women to Women OBGYN Care, or to contact your gynecologist to set up an appointment to discuss your situation. Thank you.